Hello, and welcome to the Dr. Suzette Glasner Podcast. Don't forget to hit like and subscribe if you'd like to continue to learn from me. Today, we're going to be talking about the medicinal use of cannabis and cannabis-related products. And the reason that this is so timely is because there's a tension between our growing understanding of the health impacts of cannabis and American perceptions and attitudes around cannabis use. So this tension that I'm talking about comes from two very different kind of sources of data. One is accumulating studies that have documented some of the concerns around safety and health risks associated with cannabis. But at the same time, while we understand that there are these safety and health risks, the general American perception around cannabis use is fairly positive. So, according to survey research, most Americans support the idea of medicinal use of cannabis, and the perception of the harms associated with cannabis are fairly low, and especially among young people for whom cannabis use is probably the riskiest, given that their brain development is not yet complete. And we know that cannabis among young people can disrupt brain development, can impair cognitive functioning and memory functioning, and can also increase the risk that they'll go on to experiment with other substances. One of the solutions to tensions of that nature is to really equip people with the facts. And that's what I'm here to do, is to help you comb through some of the myths versus the facts around cannabis use and medicinal use of cannabis. And to that end, I'm going to talk about three things today. The first is, what are the indications for which there are FDA-approved cannabis formulations? What type of health problems or diseases do we know from science that cannabis and cannabis-related compounds can effectively treat or help to relieve? So I want you to know what does have science behind it so you can feel confident as to whether the condition that you or a loved one are hoping to treat with medicinal cannabis is something that there is some evidence to support. And again, even if there isn't, you still may want to try it anyway, but it's better that you go in equipped with that knowledge. The second question I'm going to answer is, what do we know about the effects of medical cannabis on mental health? And I'm going to focus that discussion on depression and anxiety because those are the most common symptoms for which people use medicinal cannabis. So in relation to the question of which cannabis-based compounds are FDA approved, one thing that I think is important to clarify is that even though many states allow cannabis to be dispensed for medical purposes, and there are these anecdotal reports of therapeutic effects of cannabis for medical conditions, the US FDA has not approved medical marijuana. So there's a lot of talk around medical marijuana as though it might be an FDA-approved treatment, but there's really very little known about the long-term effects of using marijuana medicinally, except for some of the conditions that I'm going to be talking about today. So that said, there are certain formulations of THC that have been approved by the FDA for the treatment of nausea among people with cancer who are undergoing chemotherapy. There's also the stimulation of appetite for individuals with AIDS who suffer from wasting syndrome. And these medications that are known as dronabinol, also known as Marinol, and nabilone, which is also known as Sesamet, these are taken orally in pill form. There are other marijuana-based medications that use cannabidiol, and I've spoken before about the difference between THC and cannabidiol, which is also known as CBD. So THC is what we call the psychoactive compound, which leads people to feel high or an altered psychological kind of state. And then the CBD component is a chemical that's found in the cannabis plant that does not have those same kind of rewarding effects that THC containing compounds have. So it doesn't make a person feel high when it has a CBD. So currently there's one CBD product that has received FDA approval for the treatment of two rare and severe forms of epilepsy. And this medication is known as Epidiolex, and it contains a purified form of CBD, and this is taken as a liquid. So even though this is the only CBD product that has gained FDA approval, there are various other medications that either contain CBD or a combination of THC and CBD that are being investigated in clinical trials. One such compound that has been widely used in the UK, Canada, and several European countries is called Sativex. a mouth spray that is used to treat pain and tightness or stiffness in one's muscles. And that has been approved for individuals who suffer from multiple sclerosis. And that's the extent of the medical conditions for which there is FDA approval for either a CBD or a THC containing compound. Now, often people assume that CBD and THC related compounds are approved more broadly for a wider range of the conditions, but those are the ones that we have confidence in scientifically as having demonstrated a therapeutic effect from either CBD or from a THC containing product or from one that combines the two. So now let's talk a little bit about medical cannabis for mental health, and in particular, depression and anxiety, because survey-based research has shown that many people use medical cannabis to treat depression and anxiety, and that individuals with post-traumatic stress disorder also turn to cannabis-related products in order to alleviate their symptoms. So looking a little more closely at the science on medical cannabis as an alternative to psychiatric medication, there have been several studies, and those reviews have not found evidence that cannabinoids are effective as a treatment for anxiety or depressive disorders. And in particular, there's been a lot of interest in post-traumatic stress disorder. And that study found that there was really no evidence of improvement in PTSD symptoms or a remission in their PTSD diagnosis in association with their cannabis use. And in fact, those symptoms of post-traumatic stress disorder worsened for individuals who used cannabis heavily. So we know that chronic cannabis use among Americans with depression has nearly tripled over the past decade. So this is clearly either a go-to strategy that people are using to deal with their depression, or perhaps as a result of the depression worsening, there may be an increase in other behaviors such as cannabis use just to try to compensate for it or find some relief in some way. But research has shown that among people who suffer from mental health problems, the use of cannabis can actually worsen depression, anxiety, PTSD symptoms, and overall psychological well-being over time. What about what people are saying when you survey them about their use of cannabis for this purpose? Are they saying that they're getting better? Well, some of the larger surveys around how cannabis use affects psychological symptoms have shown that less than half of people who use medical marijuana for this purpose report that it provides symptom relief. And some experience what's known as rebound anxiety after they discontinue their use of medical marijuana. And this is probably the result of what we understand as a cannabis withdrawal syndrome. And that withdrawal syndrome has very prominent symptoms of anxiety and depression. In the shorter term, when people first use it, they may feel relaxed or generally a pleasant feeling, and that is obviously what they're seeking. But in the longer term, it can actually worsen some of those very conditions that they're taking it for, and a lot of people just don't even know that. The other thing to keep in mind is that the impact that marijuana will have really depends on the potency that you've consumed and the way that the potency of THC versus CBD balance each other out, because these have very different types of effects on a person. So the THC produces this feeling of euphoria, and in a sort of extreme form can make a person feel a little bit anxious, restless, and it can lead a person to feel very uncomfortable and paranoid and agitated in higher doses and with a more potent formulation of THC. And it also has this addiction liability, whereas CBD doesn't have any of those effects, can reduce psychosis, and is not thought to be addictive. So the amount and the ratio of THC and CBD in a given formulation of cannabis that a person is using really matters. And what's been happening over time as cannabis has been more widely available with cannabis dispensaries and other forums where cannabis is more widely available is that the average amount of THC in typical street marijuana has tripled in the past 20 years, whereas the proportion of CBD has declined. So now you have these products out there that have greater potential risks of producing some of these undesirable effects. I'll now just turn my attention to the issue of cannabis use disorder, because we know that for some people who are trying to alleviate symptoms of another problem with cannabis and end up using it very heavily, one of the risks associated is that they can develop an addiction to cannabis use itself. And what I want to reassure you of is that we actually have very effective treatments for a cannabis use disorder. And I want to tell you a little bit about what it looks like when people come to treatment for addressing a cannabis use disorder. So first of all, we know that people who receive evidence-based psychotherapy for a cannabis use disorder do recover, but people don't readily enter treatment for cannabis use disorder in its early phases because the effects of cannabis use on overall functioning can be very subtle, and it can take a long time. A, because cannabis is highly addictive and just difficult to cut back and stop, but B, because the negative effects may not become totally obvious very quickly. It can take time for a person to develop the insight and recognition that cannabis is affecting their personal or even their professional life or their relationships in a negative way. So usually by the time people come to treatment, they have used cannabis generally for over a decade, and they have tried many times, usually on average around half a dozen times, to cut back unsuccessfully. And people who struggle to control their cannabis use often have overlapping addiction and other mental health problems. And so it isn't uncommon for them to be really self-medicating some of those mental health issues with cannabis. And that makes it a little bit harder to give up, because even if it's affecting them in a negative way, they may also see some benefits of it in helping them to go to sleep or take the edge off when they're feeling very anxious. So it really is important to treat the mental health problem either with medications or therapy or both in order to get a handle on the issue of cannabis use. Because again, if cannabis is being used in order to try and overcome some of the symptoms of a mental health disorder, it can just be very difficult to give up before you have those mental health symptoms under control. And we know that some of the best success rates come from combining three approaches. One is known as cognitive behavioral therapy, and that is identifying the thought patterns that lead a person to keep on giving in to temptations and cravings over and over again, even if they're feeling like cannabis use isn't really serving them well. Then a second therapy approach that we know to be highly effective is known as contingency management. And that is where you give rewards or positive reinforcement for individuals who are reaching their goals in treatment, which can either be to reduce or stop completely using cannabis. And then third, motivational type therapies are very helpful because the motivation to change one's use of any substance or to change any health behavior that you've been doing for a really long time, it's just really tough. And it's very natural for motivation to wax and wane and to increase and decrease, even over the course of a day. So in therapy, in behavioral therapy for cannabis use disorder, we spend a lot of time visiting and revisiting motivation. Why is it that making this change is important? What do you stand to gain from making this change? Really having a clear sense of that, writing it down somewhere, referring back to it during those difficult moments, because the cravings for cannabis can be pretty intense, especially when they've been using in this sort of chronic and heavy pattern over many years. If you'd like to learn more about some of the therapeutic treatment options for cannabis use disorder, please check out my new book, Addiction: What Everyone Needs to Know, where I discuss in great depth the physical and psychological health related consequences of cannabis use and some of the most well-studied therapeutic approaches to successfully treating cannabis use disorder. I hope you learned something today, and I look forward to seeing you next time.